friends, welcome back to Meet Your Teeth. My name is Nevish, and today I'll be addressing the most frequently asked question, that how much a dental hygienist or therapist earns in UK. So keep watching to know more about the details and on what basis the salaries will differentiate. So before we start off, let me tell you that all this information that I'll be sharing today is purely on my experience as a dental hygienist and therapist in UK. So things could change in future, but in general, from what I have understood so far is that the salaries will vary depending upon the location, the experience that you have gained in the field, the method of payment, and if it's an independent or corporate practice. So we will discuss each one of these in detail. So based upon where you will be working in UK, the pay scale differs drastically. So this is the map of United Kingdom and I have roughly divided it into three parts. The top part is the north of UK, in the middle is Midlands, and below is the southern part of UK. So I will be talking more about the salaries in England, and I'm sorry, I'm not sure about salaries in Ireland or Scotland. This is the graph that I have prepared to help you understand better. So by looking at it, you can appreciate that the dental hygienist or therapist in southern part of UK will earn more compared to North or Midlands, because in North the pay scale is about 20 to 30 pounds per hour. In Midlands it is about 30 to 35 pounds per hour, and in south of UK it is more than that, that is more than 35 to 40 pounds per hour. Now, one reason why I think the difference is could be because obviously the capital of UK, London, is in the southern part, and majority of the big companies and majority of people like to reside in southern part of UK, in and around London, and also because of huge demand and competition, the pay is a bit more compared to other parts of UK. So next is experience. Of course, experience matters a lot because, particularly in the field of dentistry, I think the more time you spend working, the more you learn. And honestly, there is no end to learning. So, of course, if you have more experience, you can expect a bit more pay compared to what will be given to a fresher. And of course, you have the advantage of negotiating your salary with the employer as well. Next is the method of payment, which is really very important for you to understand before you accept any job offer. So every practice has their own policies and the mode of payment. And generally during the interview, the practice manager or the principal dentist will discuss more about it. So if you notice, in general, these are the three types through which a dental hygienist or therapist will be paid in the United Kingdom. So starting with the first one, uh, to be paid on an hourly basis. This is the most simplest and a straightforward one. So let's say that you are working 9 to 5 and you have a break of 1 hour in the middle. So you will be paid for 7 hours a day. Now you need to ask what will happen if the patient doesn't turn up? Will you be paid or not? Because this really depends on the clinic. Now, second is the based on the UDS system. UDS, Unit of Dental Activity, or sometimes people also call this as course of treatment. So based on the completion of course of treatment, you will be paid. Now, if you are aware, in UK, there is a banding system. I will be discussing more about it, but just for your understanding, so UDA has three bands, band 1, band 2, or band 3, and there are various procedures that come under each band. I'll be discussing more about it very shortly. And the third and the final method through which a dental hygienist or therapist is paid is on the percentage basis. So usually corporate practices follow this pattern. So basically, they'll tell you that, okay, if you do hygiene services, you'll be paid about 40% of the book. And for therapist services, you may be paid again 60% or depending upon how much you're working. So here is the NHS banding system. It is very important that you familiarize yourself before you start working in the UK as a dental professional, because you might be paid depending upon the UDAs that you gain over the time. So let's quickly revise it. So here is the NHS banding system. It is very important that you familiarize yourself before you start working in the UK as a dental professional, because you might be paid depending upon the UDAs that you gain over the time. So let's quickly revise it. Band 1 basically covers all the examination part, diagnosis, taking x-rays, giving preventive advice, doing scale polish, and applying fluoride varnish or fissure sealants. Band 2 covers everything in Band 1 plus simple fillings, root canal treatment, or extraction of the teeth. And Band 3 covers everything in Band 1 and 2 plus more complex treatment like crowns, dentures, bridges, and basically any laboratory work. What exactly is UDA? It is unit per dental activity, and the price for each UDA is set by higher authorities, and that is generally around 10 to 12 pounds per UDA. So let's say that you are performing any treatment that comes under band 1. So let's say you are just doing simple scale polish. So that means you will be given 1 UDA. And if you do anything in band 2, that is equal to 3 UDAs, and anything in band 3, it is equal to 12 UDAs. So this is the basic idea of how the UDAs will be allotted based on what the treatment that you perform. Now, if you are working as a dental hygienist or therapist and you are being paid on the UDA system, this will be divided between the dentist and the hygienist or therapist. So let's discuss more about it. Before that, let me tell you that this system of UDA is not really liked by the dental professionals in the UK, because it is not very rewarding for the dentist or the hygienist or therapist. Because, for example, let's say the patient comes for multiple fillings. So even if you do 1 filling or if you do 10 fillings, you will be given 3 UDAs only. Alright, so let's see an example of how the UDAs may be divided among dentist and therapist. Now, let me tell you that this is just an example, because different practices may have different system that they follow to divide the UDAs. So it's always best to have a word with your practice manager before you opt for the job. Okay, so for your understanding, I'll be explaining more about the chart that you can see in front of you. So let's say the patient comes for simple scale and polish. So that comes under band 1, right? And band 1 is equal to how many UDAs? 1 UDA. So the patient will be first seen by the dentist, of course, because in UK, if you're working as an NHS therapist or hygienist, every time the patient comes, they'll be seen by the dentist first, and the dentist will refer them to you for further treatment, and you work based on the prescription given by the dentist. Okay, so in the first case, as you can see, the patient comes for simple scale polish, so the dentist will check the patient, examine him, and the dentist will be given half UDA. And when you perform scale polish, you will be given the rest of the half UDA. So this completes band 1, that is 1 UDA. Okay, let's take another example. So in this, it's a perio case, and the patient comes for a checkup and a thorough deep clean. So the dentist will examine and do perio charting. So the dentist will be given 1 UDA. And when you perform a thorough deep clean, scaling, polishing, root surface debridement, and give oral hygiene instructions, you will be given the rest of the 2 UDAs. So that is equals to 3 UDAs, which comes under band 2. Does that make sense? Let's take another example. So let's say this time the patient comes for simple scale polish and a filling in one of the teeth. So the dentist will be given half UDA for examining, and they will refer the patient to you, and you will be given 2.5 UDAs for scaling and polishing, and cons. Cons is nothing but conservative treatment, that is fillings. Right. And let's take one more example of band 3. So the patient comes for multiple fillings and some I can totally understand that UDA system is a bit complicated and it is not very straightforward, especially if you're working as a hygienist or therapist. As you can see that the UDAs will be divided among both of you. So it's a bit tricky to understand, but I'm sure the practice will have uh, a good system and they will keep a record of how many UDAs you are gaining every day. And of course, it is your responsibility as well that if you are being paid on the system to keep a record of how many UDAs you are gaining every day and make a note of it. And hopefully with time you will understand the system more, because once you are working as a dentist, then definitely this is the only system that every dentist in UK is being paid on. And finally, the pay scale will also differ if it's an independent practice or a corporate practice. For example, if it's an independent practice, the salary will depend totally on the practice owner, and there is a scope for negotiation, and the mode of payment will vary depending upon what the practice owner decides for you. But of course, if you are very well experienced, he or she may be willing to pay you more. So it's totally in their hands. Whereas if you're working for a corporate practice, the salaries are set and there is not much scope for negotiation, because if you are experienced or you're a fresher, you may be paid more or less almost the same salary, because they have set their own targets for the salaries and they don't pay you more than that. Of course, if you're working in a corporate practice, it can be a bit more challenging and competitive. That's it for today. Hope you found this video useful. If you have any questions, drop your comments below or follow us on Instagram. You can also join our exclusive Facebook group for dental professionals, which is Journey of an Overseas Dentist in UK. This is basically a platform wherein we are discussing about the various dental exams in UK and about the registration process. So I'm sure you will find this very useful. And very shortly, we will also be starting our WhatsApp group, so stay tuned for all the updates. And alternatively, you can also send me your queries at mnk.dentist@gmail.com. Please don't forget to like, share, and subscribe to hear more from us. See you next time. Bye.